Hello, hello. Welcome to SalivaCast. I am your host, Dr. Deborah Heller. I am a dentist. I am a university professor. I am a scientist. I am an entrepreneur. And my mission, my goal is to bring for you everything about saliva testing, saliva diagnostics, everything about saliva, so that you can have a more efficient diagnosis of your patient in your clinical practice. Welcome, welcome to SalivaCast. And today, we are diving into a crucial topic: saliva and hydration. Right now, it's actually carnival season in Brazil. It's really hot. It's summer. And I bet if you are connecting with me right now from somewhere where it's summer and where it's hot, you've been feeling that dry mouth sensation. That's right. Hydration and saliva go hand in hand. Your saliva is a direct reflection of your hydration status. And today we are going to break down why that matters and how can we monitor it and what cutting edge technology is available to help you. So let's start with the basics. Hydration levels directly impact salivary flow. When you are well hydrated, your salivary glands work normally and you don't even think about it. But when you are dehydrated, your body prioritizes essential functions, and unfortunately, saliva production isn't one of them. This results in a dry mouth, and we all know how uncomfortable that can be. As the predominant fluid constituent of saliva is water, 97 to 99.5%, which enters saliva from plasma across acinar cells. It follows that hypohydration may cause salivary gland hypofunction. And if you have been following SalivaCast and if you're a dentist, you know that saliva is essential for maintenance of oral health. Saliva is essential for good oral health. And think with me, the primary constituent of saliva is water. And traditionally, decreased body water homeostasis has been linked with salivary dysfunction. This is consistent with the greater prevalence of dehydration and salivary gland dysfunction among the elderly, for instance. But are there indicators of dehydration? How do I know if I am well hydrated or if I am dehydrated? Well, a decrease in saliva flow, lower salivary flow rates, is a key indicator of dehydration. In fact, research has shown that fluid losses of just 2 to 3% of body mass can impair heat dissipation, cardiovascular function, and exercise performance. The best hydration assessment methods that are today, like for example, like tracking, stable isotope tracking, or urine exams, they are expensive, and many times they are even a little bit impractical to use in a daily basis. More commonly used markers include both hematological and urinary parameters, but this can be many times invasive and inconsistent. So I want to focus on saliva, of course. This is Saliva Cast. A recent study actually demonstrated that saliva flow rate, osmolality, and total protein concentration in saliva during progressive dehydration. Specifically, as dehydration progresses, saliva flow rate decreases significantly. Saliva osmolality and total protein concentration increase, and these saliva changes, if you may be asking right now, they correlate strongly with plasma osmolality, a gold standard as a hydration marker. There's actually a classical study by Jonathan Shipp and Dana Fisher entitled The Relationship Between Dehydration and Parotid Salivary Gland Function in Young and Older Healthy Adults. They explore the effects of dehydration on salivary gland function. The study found that body dehydration leads to decreased parotid salivary flow rate in both young and older adults. Even after metabolic rehydration, look how interesting this is. Through intravenous fluid, unstimulated saliva flow rates remain significantly lower than baselines, highlighting a little bit lasting effect of dehydration on saliva function. There is a more recent study by Walsh and collaborators entitled Saliva Parameters as Potential Indices of Hydration Status During Acute Dehydration. And they investigated whether saliva flow rate, osmolality, and total protein serve as a reliable hydration marker. And this study compared saliva parameters with plasma parameters and with urine parameters during progressive dehydration. And the results show that saliva is as sensitive as urine in tracking hydration changes. Furthermore, dehydration had a greater influence on the decrease in saliva flow rate during prolonged exercise, reinforcing saliva roles in as actually a hydration marker. So this is key, dentists, and this is key to our clinical practice because as dentists, as health professionals, we can actually monitor saliva flow rate in our daily routine. This is a very easy, validated standard test. It takes 2 to 3 minutes, maximum 5 minutes to be performed, and you get the results right there. And by knowing saliva flow rate, you actually, like previous studies have shown, will have a very good information about your patient's hydration level. And if you are a patient and you tune into Saliva Cast right now, you can ask yourself, like, what can I do to make sure I stay hydrated? How do I do to make sure my saliva keeps flowing? Well, first, drink plenty of water. The recommended intake of water is about 35 ml per kilogram of body weight. Another tip to stimulate saliva flow is chew sugar-free gum or suck sugar-free candies. They can help boost saliva production. And of course, avoid everything that dries your mouth. So avoid excessive caffeine, alcohol, as they contribute to dehydration. So how can we monitor in the dental office? And now here's where it gets really exciting. Did you know that we can access hydration levels in a dental office using a simple, validated test? One of the easiest methods is unstimulated salimetry. This is where we measure saliva flow rate, the flow rate of saliva. So here is exactly how it's done. Make sure you take a pencil or you take your iPhone notes and write this now, because I really want you to use this at your next appointment. So the patient is instructed not to eat, drink, or chew gum for at least 1 hour before the test. The patient sits comfortably with their head slightly tilted forward. Okay, if you're watching the video, you can see me doing that. My head is slightly tilted forward. We give them a recipient, a cup, any plastic cup from the office, and we instruct them to spit in the cup, okay, for a fixed period of time, between 2 to 5 minutes. And the volume of saliva collected is then measured, and the flow is calculated in ml per minute. So it's actually very easy. I'll get a cup and I'll demonstrate for you right now. So I'm actually holding a cup right now. The cup doesn't need to be as big as this one. It can be actually like a coffee small cup, any plastic paper cup that you have in the office, okay? So the patient has the head tilted down. You instruct them not to swallow anymore, and all the saliva being produced is now being released into the cup. And you put on the timer. Deborah, I don't have a timer. Yes, you do, from your phone. So you turn on the timer from your phone and you put there 5 minutes. And you do this for 5 minutes. Like every minute, you remind the patient you can spit now. You see, it's called the drooling method. It's really simple, it's straightforward. At the end, you get a syringe that you already have in your office and you measure. You measure the amount of saliva produced divided by the time, if it was for 2 or 5 minutes, and you get the flow rate. Okay? This is the unstimulated saliva flow rate. Easy, simple, validated by science, and should be in your dental office. If it's not already in your clinic, make sure you start doing this exam today. And if you follow SalivaCast, if you follow myself on YouTube, Deborah Heller on YouTube, or my Instagram profiles, I have a new English Instagram profile, actually. It's called Dr. Deborah Heller on Instagram. And I have my more like with more followers and older profile that I use it more, which is a dentista cientista, the dental scientist on Instagram. So you can follow me there. But if you saw any posts that I did in the past years, you know that I love innovation. So speaking about innovation, I also want to bring to you innovation about saliva and hydration. And there's actually a new technology, and I love it. It's called MX3. This is a saliva-based hydration monitoring system that gives results in less than 3 seconds exactly. So we go from saliva flow rate in the clinical practice that you can do right now, which takes 2 to 5 minutes, and we go to a test that takes 2 to 5 seconds. Yes, you heard that right. About 3 seconds. That's already being used in sport teams around Brazil, around the world. Actually, the Brazilian Olympic Committee is using it. I heard Cristiano Ronaldo is using it. So, how MX3 works? The MX3 hydration testing system actually allows you to take a quick sample of saliva anytime, anywhere. The device provides lab accurate results that are stored in an MX3 app where hydration levels can be tracked over time. This makes it really easy to stop to actually to spot dehydration risks in individuals or teams or and adjust, of course, hydration strategies accordingly. So we all know that we perform better if we're properly hydrated. And MX3 actually brings technology to help us understand and adjust this critical factor. So it is fast, it is reliable, it is non-invasive, it is saliva-based. That's why I love it. And I truly believe this is a game changer for clinical and sports applications. If you're interested in incorporated hydration assessments into your practice, stay tuned. This week, Saliva Pro will release a demonstration class on how to use MX3, step-by-step guide. And we also have a special offer if you're interested. And also at Saliva Pro and at my YouTube channel, Deborah Heller on YouTube, you'll find videos of how to do the free test, saliva flow rate. You can and you should, and in my opinion, you must start doing it in your dental practice. All right, let's wrap things up. We've talked about how hydration impacts saliva, how we can monitor it in the clinic, and we spoke about the latest technology that's making it easier than ever. And as you go about your day today, and here in Brazil, we're actually celebrating Carnival, so I'm not seeing any patients today. Or as you go about your routine, remember to stay hydrated. And for all my fellow dentists out there, keep an eye for this exciting field of saliva testing. And you can count on me here at SalivaCast to always bring the newest and technologies and all information about saliva to your dental practice. As always, thanks for tuning in to SalivaCast. If you enjoyed this episode, don't forget to follow us and to check out Saliva Pro for more updates. I'll see you next time. Stay hydrated, everyone.